Welcome to another edition of the Invisible Wheelchair Interview Podcast. I'm Donald Grodoff, family coach with FamilyOCD.com, FocusedHealthyFamily.com, and of course, InvisibleWheelchair.com. In the Invisible Wheelchair interviews, I get the wonderful chance to interview some of the experts with obsessive compulsive disorders, professionals that treat OCD, people who are going through or have been through OCD, parents and caregivers of those suffering from OCD, and of course anyone that advocates for treatment of OCD. My goal of these interviews is to inform people on all aspects of OCD and bring about awareness of obsessive compulsive disorder. The content, information, resources, and ideas that are talked about and brought up here in these interviews are not necessarily the views and opinions of myself, Family OCD, Focused Healthy Family, and Invisible Wheelchair Podcast, and I always recommend to seek additional professional help in finding solutions for yourself. You can find out more about me at FamilyOCD.com, FocusedHealthyFamily.com, and InvisibleWheelchair.com. This Invisible Wheelchair Podcast interview was recorded May 8th, 2019. I feel privileged to be introducing you to Dr. Kurian Abraham from the New Hope Specialty Clinic, where he is introducing a new OCD clinical trial that you, if you meet the criteria, could be part of. Now let me tell you a little bit about Dr. Abraham. As a diplomat of the American Board of Psychiatry and Neurology, Dr. Abraham is an active contributor to the clinical trials for Alzheimer's disease and offers more than 16 years of experience in diagnosing and treating other disorders of the central nervous system. He specializes in psychiatry and neurology and is the co-founder of the New Hope Specialty Clinic in Charlotte, North Carolina. Dr. Abraham has a Duke GlaxoSmithKline Psychopharmacology Research Fellowship. He is involved in clinical trials for current Alzheimer's medications available in today's market. He has been part of over 100 protocols as an independent principal investigator and has put in extensive work at the Anxiety and Trauma Division of Duke University, researching mood stabilizers for preventing manic episodes of bipolar disorder. Dr. Abraham has also won numerous awards for Most Outstanding Resident for his research at Duke. Graduating from KEM Hospital in Bombay, India, with his medical degree and pulmonology fellowship, Dr. Abraham completed his psychiatric residency at Eastern Virginia Medical School in Norfolk, Virginia. He has also completed a fellowship in neuropsychopharmacology and new drug development from Duke University. Dr. Abraham offers diagnosis and treatment of a variety of disorders, including anxiety, depression, bipolar disorder, post-traumatic stress disorder, and schizophrenia. In addition to his clinical work at New Hope Specialty Clinic, Dr. Abraham is also responsible for training all the investigators at the New Hope Clinical Research. Now, let's go to the recording. Dr. Abraham, thank you so much for being part of the Invisible Wheelchair Podcast. I'm very grateful to have you as part of this.
Thank you so much for having me for this interview, especially an investigational product being tried on obsessive compulsive disorder, which has no treatment per se at this time.
As I do with all my guests, Dr. Abraham, I ask them to give a little bit of a personal background maybe about yourself so they can understand you better and know you a little better. So if you could do that, I would very much appreciate that.
I am an American Board of Psychiatry and Neurology board certified physician who has done a fellowship with the Duke Medical Center and GlaxoSmithKline for new drug development in every specialty. So I chose this career, especially in psychiatry, because there are not much curative medicines are available at this time. So we are trying to bring some innovative treatment to give some sort of relief to the suffering millions of people, especially certain subset of psychiatric disorders like obsessive compulsive disorder, which has no treatment. And what currently the clinicians are doing is just treating symptomatically and do some therapy.
So, Dr. Abraham, I'd like to have my audience and myself know a little bit more about your clinic itself. You know, what you do there, what different things that you work with. I know we're talking today about OCD, but I know you go a lot further than that in your clinic.
We, New Hope Clinical Research, is doing all the clinical trials of new investigational product in different specialties. And our main focus is on central nervous system disorders. In other words, neurology and psychiatry, that is our main focus. Having said that, we do clinical trials on other specialties like diabetes, heart condition. But this is our main focus. We have 11 investigators in different specialties, and we have several study coordinators. We try to bring new innovative treatment for conditions which have no cure so far, like Alzheimer's disease, or OCD, generalized anxiety, major depression, bipolar disorder, schizophrenia, Tourette syndrome, multiple sclerosis. All these conditions have no cure yet. So we are trying to bring something for the public in collaboration with the pharmaceutical industry.
Since we are, like I said, we're talking about OCD here in this podcast, could you tell me a little bit more about what you're doing in specific to obsessive compulsive disorder or OCD?
Currently, FDA has approved 2 sets of medication for obsessive compulsive disorder, which are not, in every sense, it is not a curative medicine. It's basically reduces symptom to a certain extent. One is clomipramine or anafril. This is an older tricyclic antidepressant, which has a lot of side effects, particularly cardiovascular side effects and dry mouth, and we call anticholinergic side effects. Then the selective serotonin reuptake inhibitor, SSRIs, which are also, especially luvoxamine, Luvox or fluoxamine, is being approved specific for OCD, but other like Paxil, Prozac, citalopram, Lexapro, all these doctors try everything. But is it a real cure? And for intractable OCD, surgery is another option, psychosurgery. And OCD is the only condition in psychiatry which can show physical evidence in the brain, especially in the white matter. We can see evidence. We call this a Pape circuit. So that circuit being somehow manipulated by genes or environmental factors, nobody knows exactly how it happened. But patient repeatedly does think his loop is being manipulated by either neurotransmitters or genetic factors. So this particular, at this moment, the treatment for OCDs mainly are what we talked is fluoxamine and older generation. But this current medication is acting on 3 neurotransmitters, serotonin, dopamine, and norepinephrine. This kind of mechanism has not even come so far in the market. All the other medications, either they act on serotonin or norepinephrine. In that scenario, this is definitely a novel method to look into and go through each stages of the studies, and hopefully it will separate from placebo.
So I want to make sure I understand it. Are you saying that the SSRIs that you've talked about, like fluoxetine, um, they haven't really hit their potential of what they could do? Am I understanding it that way, or is that wrong?
No, it is only a symptom relief. It is not for the cure,
Okay.
because it acts only on serotonin, with fluoxetine or the Prozac or Paxil. It acts only on the serotonin transport mechanism. But the older tricyclic antidepressant clomipramine, it acts on norepinephrine. Here, they are coming out with a new investigational product, act on serotonin, norepinephrine, and dopamine, which is considered to be the reason for some malfunctioning of these neurotransmitters are responsible for OCD symptoms.
So in other words, it goes further than fluoxetine does. Now you mentioned, and I think I heard it correctly, about surgery, and I don't think I've ever heard of that as far as with OCD, especially.
Yes, in intractable OCDs where life is totally dysfunctional, they manipulate this circuit. It has Pape circuit in the brain, which gives complete cure for OCD. But it may have its own some other side effects also they have, because
Okay.
OCD is cured, but something else is there now. Third thing is we do is ECT, electroconvulsive therapy, for obsessive compulsive disorder. It is indicated, ECT, but it gives only a transient relief, not permanent relief.
Now I know one of the reasons you've come on here is you're beginning a clinical trial around OCD, if I'm not mistaken. If you could tell me a little bit more about that, that would be great.
This is a randomized, double-blind, placebo-controlled trial as an adjunctive treatment, add-on with the current medication. They are not independently trying only this medicine alone. Okay, what all medicine you are on, you will be there on a fixed dose. You cannot change that dose after entering into the study. Then you add on this medicine or placebo, which nobody has any clue. It's all computer generated. This IPs, this investigational products, usually we give numbers. I have an BHP 4157. That's the name of the drug at this moment. That's what FDA wants. Nobody wants to identify what is the exact name of the drugs. They don't even mention. It is BHV 4157. That is actually one of the cousin of this medicine has been tried for ALS, Prelutec, amyotrophic lateral sclerosis, or Lee Good's disease.
Mm-hmm.
They have tried this medicine, which is at least it is controlling their these motor symptoms and sensory symptoms. This is one of the derivative of that drug.
Okay. And it's done well with ALS?
Yes.
Who fits the criteria for that clinical trial then? Who are you looking for?
Male and female ages 18 to 65 years inclusive. 18 to 65 inclusive.
And you said 18 to 65. Did I hear that correctly?
Yes, sir.
Thank you. Men and women.
They should be diagnosed with the OCD 1 year or more. Clinical trials, we cannot diagnose a patient. They should come with the diagnosis for at least 1 year duration. Then currently in treatment for at least 10 weeks with the medications like citalopram or Celexa, Lexapro, fluoxetine or Prozac, fluoxamine, that is Luvox, or paroxetine or Paxil, sertraline, Zoloft, clomipramine or Anafil, or venlafaxine or Effexor, or Pristic. That's venlafaxine. So any of the SSRIs or SNRIs or clomipramine, they should be under treatment for 10 weeks minimum. And they should be on stable dose for at least 12 weeks. And patients should have 6 years of education minimum. The duration of study is 13 months. Subject will be, or the in clinical trials we call subject, not patient anymore. Subject will be compensated for each completed visit. Each
Okay.
completed visit, $75. Exclusion criteria. What are the exclusion criteria? They should not have any other psychiatric disorders like schizophrenia, autism, autism spectrum disorders, borderline personality disorder, antisocial personality disorder, body dysmorphic disorder, hoarding disorder, Tourette syndrome. So these are the main other psychiatric DSM-5 criteria should not be there. They should not be failed in at least more than 2 treatments. So if they are failed in more than 2 means, in other words, it's a treatment resistant, looks like. So they should not. Then no major depression, no active depressive symptoms. They should not be suicidal. So history of surgery, psychosurgery, deep brain stimulation, or ECT, they are excluded. Then substance use disorder. They cannot use cocaine and alcohol or any other street drugs for at least 12 months. Then any cerebrovascular accidents like stroke, seizures, traumatic brain injury are not allowed. Then their body mass index more than 40 kg per M2. They cannot have more than 40 BMI. In other words, they cannot be morbidly obese. That's all it is.
Okay.
No cancer in the past 5 years. But little bit of skin cancer or okay, squamous cell carcinoma, but no other serious malignancies. Then congestive heart failure or unstable angina, they are not allowed. Then hepatitis B, C, HIV, or syphilis are not allowed. Any sexually transmitted disease, serious one. Hepatitis B, C, HIV, and syphilis. Then any diagnosis of active peptic ulceration or GI bleeding within the last 6 months, or any chronic inflammatory disease like Crohn's disease, ulcerative colitis are not allowed.
Okay.
Any GI surgery, because it impacts the absorption of the drug, gastrointestinal surgery. So that are the main exclusion criteria and inclusion criteria we talked. And that's it. Then they come for screening. So screening, we do all the labs, EKGs. If any of the exclusion criteria, patient may be screening, they may be good, but on the lab and EKG, suddenly for QTC prolongation, then lab liver enzymes more than 2 times more than the upper limit of the normal range. All these are exclusions, So that we will educate them um, what exactly the labs, and we will tell them. And if something found immediate attention, we will call the primary care doctor and we give them the medical records and the lab reports so that they can get it treated even if they are not qualified for the study. That's a great service. I have in my career, I have seen patients coming for clinical trials with heart attacks, kidney cancer, and they have gone to the primary care 1 or 2 months back. Nobody could find anything. So we found that, and patient is exclusionary, but we will direct them which their primary care or the concerned specialist, we direct them.
So in other words, if you find something in those exclusionary, you will help direct them to somebody to help them out with that.
Yes, sir.
Now, I want to ask, have you found anybody at this point, this trial?
Yes, we have 2 patients already been screened.
Okay.
Out of that, see, what happens is once we screen, there is a remote screening by the sponsor. We call safer interview. That should be done in their home, not even here. So that we cannot even coach them what to say. So they want to, recruit the right population.
Yeah.
In order to get the right results, if the drug is not effective, then we can discard the drug. If the drug is effective, but if you get the wrong population, then also the drug will fail.
Yeah. Yeah.
So we want to make sure that the right population come for the study.
Yeah, I was just curious because in listening to all the exclusions, I heard depression in there, and I find the work I've done and in my own personal experience with OCD is that it almost plays as a subset of all these other ones. That's the tough part about it.
Psychiatric disorders, we have to think about it. It's a very gray area. Most of the diseases overlap each other. Think about OCD. But there are some patients with the obsessive compulsive personality disorder. They want to keep everything on right place. They are meticulous. They keep the bed morning, first thing they get up and do their beds. They clearly keep it right. People say, hey, he's OCD. Now, it's an obsessive compulsive disorder, not disorder, personality disorder.
Yeah.
For that, you don't need any treatment.
Yeah. No, I run into that a lot myself because I always have the people that say, "Oh, that's just my OCD," and they have no clue as to what it's really. I know from personal experience of what I've been through with my daughter and my son of what it's really like. But we can real quickly touch. I mean, is there any certain? There are a few different types of OCD. Are there any certain types that are particular for you or not?
No,
Like we talked about pans and pandas and things like that.
first is obsessions. They don't have any compulsions. Obsession itself is enough. Or compulsions, both.
Okay.
So, or it could be both. And obsession also that the intrusive thoughts keeps coming, which the patient knows it is irrational. Still it comes, they can't stop it.
Yeah.
So
Yeah.
that is they spend hours and hours of the time and they try to resist. They try to avoid. It's not possible.
Yeah.
So we, one of the rating scale is known as, you might have heard about Yale-Brown Obsessive Compulsive Disorder Scale, Y-box.
No, I hadn't.
Yeah, Y-box is the universe standard rating scale for OCD. Y-box. You can look into the Google and see. It is a Yale-Brown Obsessive Compulsive Disorder Scale.
I will do that.
Yes.
So just real quickly touch on, if we could, on the Pandas and Pans ideas. Is that going to play into the trial? Because that's really going into more of an autoimmune scenario.
Yeah, but this is they are clearly looking into, and even OCD itself. we do not know what is the real cause.
Yeah.
There is a school of theory saying that it is an autoimmune, like Pandas, you know. So we don't know, but they are looking into symptom relief. That's what they're looking into. Probably it may not be symptom relief itself is very good for patients. You know,
Oh,
overall abnormality is there, that's fine. But if I don't have a symptom, that's what it matters, because it makes their life really miserable.
do they have to be in town, or can they be? Is this for anywhere?
No, they can come from anywhere, but they have to come for the visits on a regular basis.
Okay.
Only plus or minus 3 days. That's only the window. They cannot miss a visit. Sure, because if they visit, then they are non-compliant. Go out of the study.
Dr. Abraham, can you tell them how would they best get a hold of the clinic to be able to, if they feel they're part of this trial, what would you recommend them to do to get a hold of you all there at the clinic?
Actually, we have the study coordinators. They will give their number, especially Dr. Marin, her number, and our main phone number is there. And we have our own website, New Hope,
Okay.
www.newhopeclinicalresearch.com. So you can log in and put your name, and it will come to us. We will be looking every weekdays, every other hours, they will be checking. And if the patient within 10, 15-mile radius, if they want transportation, we will provide transportation.
Great.
If they are coming fasting, and in the visits, some visits are very long visits, we will provide them. If it is breakfast time, we will provide breakfast.
Okay.
If it is lunch time, we provide lunch. And we make sure that they are comfortable.
Well, Dr. Abraham, thank you so much for being part of this. I will have all this information up on the site with your web address, all of that, phone number, so they can find it there too. So, again, thank you so much for being part of this.
Okay, thank you so much for having me. And this could be a starting point for a collaboration.
This concludes this podcast. We really would appreciate your comments. Simply leave a comment at www.invisiblewheelchair.com. There, you're able to submit a comment that will help us determine future podcasts. If you or someone you know would like to be a guest on the podcast, please email don@invisiblewheelchair.com. Remember, there is a corresponding tapping recording for each of the podcasts, with the exception of the interview podcast. You can find these tapping recordings and archive past podcasts at www.invisiblewheelchair.com. Finally, there is relief for OCD, and we at FamilyOCD.com and FocusedHealthyFamily.com can help you find that relief. Again, you can contact us through those sites, FamilyOCD.com or FocusedHealthyFamily.com. You can also find us on Facebook at Invisible Wheelchair Podcast. You can find us on Twitter at InvisibleWheel1, that's the number 1, or at FamilyOCD. So thank you for listening. Keep tapping and transcending your life to new heights.